So neuropathy, essentially impairment or disruption in how the peripheral nervous system functions, right? Um, so exactly where the problem lies depends on which nerves it is, which makes sense, right? Um, so that is a part. I know we're kind of discontinuing the neuro one, but that can happen anywhere. It can be hands, feet. It can be any portion of the nervous system. Um, there could be neuropathy going on. So changes in the GI tract. Um, Anything from tooth loss to they don't produce enough saliva. Bowel diseases are more susceptible to. Stuff moves through slower. Basically, everything kind of slows down, like we can talk about, right? GI bleeding can be top or bottom. The GI. To be honest, a lot of that's going to depend. Where's the blood coming out? Are they vomiting blood, or is their blood coming out in their stool? Can be a result of inflammation, can be obstruction, can be trauma. It can be a lot of things that cause issues in the GI tract. Okay, diverticulitis, inflammation, essentially. Ulcers, gallbladders, a lot of things that can go on. And again, with abdominal GI stuff, we don't sit and necessarily try to determine exactly what's going on. We're going to ask generic questions. We're going to ask about do you take NSAIDs, aspirin, um, Aleve, those type of things. Um, do you drink alcohol? Right, you can ask about their diet, etc. How long has it been since you had a bowel movement? All those generic questions, but we're not going to necessarily going to try to sit and um, pick apart what they've got going on. Right, we treat it as severe and go. Acute abdomen, right? Non-gastrointestinal, so non-GI tract. What could be going on? We don't know, right? Same thing could be a AAA, pain, right? Pain in the abdomen, acute abdomen. Could be gynecological issues, right? Although usually in elderly, those are minimal. Could be a lot of different things going on there. Renal system, kidney function, um, right? Not as much blood flow. Not as again, we've got hardening of the arteries, right? The blood doesn't go through as well, which makes the kidneys not function as efficiently. Oops. Right? Bladder capacity, it's not as flexible, not as stretchy, right? So they got to pee more often. Got to get up at night to pee, right? Decline in sphincter muscle control, right? You know, More likely to wet the bed. You kind of, people joke about as you get older, it's just like becoming a baby again, right? Um, so may not know when they have to go to the bathroom. So there are issues with the renal and urinary system. Okay, incontinence. It doesn't just happen, right? It doesn't mean that your bladder does decrease flexibility, can't hold it as long, right? But that doesn't mean that they wet themselves as is normal, right? It happens to elderly, but it doesn't mean it's just normal. Um, so it is a sign of something wrong, right? You can't just pass it off as normal. Whereas getting up to pee in the middle of the night is normal. Um, Urinary retention, right? If they hold their pee and are not able to go hold their urine, it can cause inflammation and infections, right? Which can become kidney infections, right? UTI can progress up and become renal infections, which can get real bad. So they're always monitoring um, nursing home patients and such for UTIs for that reason, right? Um, so thyroid hormone slow, right, which means fatigue, slower heart rate. They don't feel so good. A lot of elderly people take thyroid supplements, take pills. That's the only pill my grandma takes is a Synthroid, which is a synthetic thyroid hormone, right, to help fight off some of these things. Okay, HHNS, type 2 diabetes, can obviously affects older people. Okay, so be watching out for that. If they are diabetic, we might want to be checking blood sugars more often in some of those. Immune changes, right? Obviously, more susceptible to infections, less able to fight it off. Body's slowing down. Your lungs aren't getting the crap in and out as well, right? So, all in all, more susceptible to infections. Musculoskeletal, we talked about osteoporosis, right? Bones become brittle, right? Decrease in bone mass in general. Joints aren't as flexible, right? Muscle tissues break down, right? All of this happens as they get older. They're therefore weaker, right? They're just that flexible. Can't get around as well, slower, more likely to sprain and strain things. There's your osteoporosis, right? Which is a disorder. It's not just a normal process. Osteoarthritis is in the joints, right? Breakdown in the joints. The cartilage goes away. Bone spur makes it painful to move, right? Makes the joints stiff. You can get osteoarthritis really in most of your joints, right? Knees, hands, hips, spine. I know people have had it in their back, neck. So, change of the skin. Skin's not as pliable. Skin tears. I know we've referenced that in the past with elderly people, right? When you pinch your skin, right? If you were to do that on a larger scale, our skin is flexible when you're young, and as you get older, that skin can just rip when you're doing that. So it is a problem with falls. With if they fall against something and hit their arm, arm pushes, slides against the table, that can cause a skin tear. Pretty common. So don't sweat as easy. Pressure ulcers, bed sores, right? That's the other thing that's called bed sores. They get, if they lay in bed, sit in a chair too long, they get sores on where the body makes contact with the bed, chair, whatever, and get a sore. That sore can get infected. Can be a bad deal. So be looking out for bed sores when removing patients. You do want to, just because there's less padding, less fat tissue, muscle tissue on some of them, when they're laying down, you might want to, or you're going to want to, use pillows or blankets or something to pad the bony areas, or if there's a void, under the back, fill that in. Toxicology, right? Their kidneys don't work as well, the livers don't work as well, so they're more likely to be affected by bad stuff in their blood. It doesn't get filtered out as readily. Okay, so something to be watching for. Lots of meds, a typical senior citizen has a whole bucket full of medications they take every day. So there can be, people take over the counter, they take herbal stuff, things that they don't have prescriptions for, so there's not a doctor or pharmacist looking over it. That can cause issues. So you always want to get a full list of what they take. When we go in there and we say, what medications are you on? A lot of times you just want to get that med list and get everything. Whether it's over the counter, whether it's herbal, whether it's prescription, get all of it. Okay. There's polypharmacy, right? Exactly what it means. Okay, multiple prescriptions, overdose, right? Elderly people think, sometimes confused, sometimes issues with memory. Did I already take that medication? Oh, I don't think I did. Ooh, take another one. Now you've got twice as much in your system. Okay, maybe enough to be an overdose, may not. So just be aware that you might have drug interactions, you might have accidental overdose. Okay. The other side of that is medications are expensive. We've talked about this before. Our healthcare system is backwards here. It gets very expensive for these elderly people on a fixed income to get some of their medications, especially if they're not essential life-saving medications. It can get real expensive, and they may not take them. They may take half doses, right? They may, there might be issues there. They might not be able to get in the containers, right? They might not know they're supposed to take them. So be aware of that when you see med lists too. They may not take everything all the time. Depression is a disease. Okay? We've talked about that in the past. It really is. I, knock on wood, never grew up with it until now. My dad with his Parkinson's, he deals with some depression, anxiety. As my mother gets older, she's dealing with a little bit. My wife deals with it a little bit. So it's a disorder that needs to be treated. Okay, so if it's not treated, okay, this is something, to be honest, I never really paid attention about until 4 years ago. My grandfather shot himself, committed suicide. He, had some depression going on. He also, his pacemaker kept shocking him, and he wanted to just be done, and he took it in his own hands. Okay, it happens a lot, and I didn't really realize it until it affected me. But I can tell you, it's out there. So be aware of that. Older men, okay, middle-aged and up, not necessarily just elderly, but older men. They do it more. They're more successful at it, right? And so something to be aware of. Okay, that is out there. Okay, GEMS. Okay, geriatric patient, environmental assessment. How are they doing? What are they doing? What's wrong? What could be wrong just from looking around? Medical assessment, which is what we do, right? Social assessment. Okay, who's around them? Are they with? Do they see their family every day? Or they have a spouse, right? Do they have friends that stop by? Are they in a group assisted living home, or are they by themselves and isolated, right? So, just some notes to take down while you're assessing the patient and recording your notes. Okay, so we know talking to a patient, some things here. Okay, may be tougher to communicate with, right? May not be fully aware of what's going on. May have a lot of medication issues. So your scene size up. Okay, where are we going to find them? We're going to find them in a variety of places, right? Alone, in a group home, with family. Okay, so take notes of that. You may not be able to get in. That is a little complicating side effect sometimes. Is access to the patient. Sometimes the door is locked, you can't get there. Mechanism of injury. If they don't know what's happening, you don't necessarily know what's happening. You might have to look around. The walker's laying on the floor. They're on the floor. Walker's on the floor. Lamp's tipped over, right? Whatever. It might give you some clues to what happened. Okay. If there's a family member that visits regularly, that's there, or caregiver, something like that, is a source of information. Primary assessment, just like always, right? Just like always. Poo, airway breathing, circulation, just like always. Suction if you have to. Okay. Yep. Perfusion, we're checking that. They may have poor perfusion anyway, or poor circulation anyway. So it might be tough to find, but keep an eye out for those signs of shock. Right? Life threats. Treat them to the best of your ability. Transport the patient. Older patients, when they crash, they'll crash hard and fast. So keep an eye on those vitals. Okay? It's not going to hurt you. Even if you'd only have to do it every 15 minutes to reassess, do it every 5. Who cares? Right? Not going to hurt anything. All you have to do is, if you have an automated blood pressure, push a button. Not hard to do. So, chief complaint, check it out. Here is the LOC acute or chronic. All right, what are they normally like? How responsive are they normally? How well do they talk normally? Right? Those are questions we're going to ask. Sample history. Okay, you may or may not have to rely on somebody around. Right? It depends how clear the patient is. Don't assume that the patient can't answer, but if the patient proves to not be able to answer, you're going to want to turn to caregiver or family. Okay, physical exam, protect their modesty. Only examine what you need to examine. Okay, keep them warm. Vitals. Just know that there are different medications they take that could affect their vitals. Okay, it's a good thing to learn to know, but you don't really get tested on this. But there are medications that will cause heart rate to be slower, blood pressure to be lower or higher, both of those. So keep that in mind. Blood pressure is usually higher, right? Cap refill, circulation is not as good. Okay. Make sure you're listening to lung sounds and do the check pulse ox. Reassess often, right? That's all we can say. Reassess often, check on them. Make sure you're documenting that's no done. Okay. Geriatric assessment guidelines. Okay. A lot of it is look around. Look around. Talk to the patient, listen to the patient, realize it's going to be tough. There's some guidelines there. You can read through those. Hit pause and read those. That way I won't spend extra time. Trauma. Okay, they don't compensate as well, right? So they're not going to sustain through shock as long, right? So if they go into shock, it's going to end faster than, it's going to end badly faster than it would with a younger patient, okay? It takes them longer to heal. We might not see, they might always be in pain, or they might not feel pain the same as everybody else. So know that what would be a 3 out of 10 for a elderly patient might be an 8 out of 10 for a younger patient. So elder people, higher risk of anything, crossing the street, getting hit, or burns, or any of that, right? Know that if they're dehydrated, some of the natural problems that happen with aging are going to make trauma worse.